It sounds like you were exposed to MDT fairly early on, but you might have had some practice prior to that. Can you even contrast your thoughts in terms of, okay, yes, there are certainly clinicians who can effectively and safely serve as a primary care provider in terms of musculoskeletal assessment, but there is an added value and an added framework that's beneficial for safety and for effectiveness when a clinician has been trained in MDT. Can you speak on that?
I can, and I think I can also add the fellow training in there as well. So
Sure.
I think based on the assessment algorithm, whether it's the subjective exam or a physical exam or a movement exam, those things, those data points start to add up to go back to the original statement. Hey, this is a patient that's safe to move. It's not safe to move. There's red flags, there's yellow flags. I was really impressed when I started with Ron Schenk. He basically showed me his algorithm for assessment. And that's what I noticed. It's very similar, whether they were doing static or dynamic movements or passive movements and things like that. So yeah, that's what I've noticed for postgraduate physical. So postgraduate physical therapists who ventured into MDT or advanced credentialing, that they really have a treatment algorithm that helps them. So to me, that's a consistent thing. It takes into account safety. It's a repeatable thing, right? So it's something I can hang my hat on as a clinician, going, I treat everything the same. Safety's built in, and I have a rationale and an objective and a subjective paradigm that I can do to get after these things.
Mm-hmm. Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.